so fast and it's pumping so much. And that's going to be the workload or the output of the heart. So again, you don't have to calculate it ever. Just understand the things that affect it. So let's do that. Let's measure the heart rate. Right? So you're taking a pulse. So most people are in the 70s-ish, so we're going to call it 75. That's your pulse, that's your heart rate. How would we measure stroke volume? Let's find out. That's the stroke volume. How much blood gets squirted out of your heart, pumped out by the ventricles, right? Because ventricles pump out each beat. So this heart's ejecting some blood. It's an average about 70. Okay?
Wait, how do I measure that?
That's the hard part. You can't, right? Well, you can. You can rip out someone's heart. What they do is they do it mathematically doing this concept. So you're going to take how big the ventricles are at the, notice this phrasing. You know these words. What's systolic mean?
Squeezing.
Squeezing. So the size of my ventricles when they squeeze versus the size of my ventricles when they, what size does that mean? Relax. So you're comparing the size of the chambers. If you do a little math, you can calculate the difference as being how much I ejected, right? So on those graphs you learned last class, you basically subtract the top and the bottom, and then you would get how much blood, if it's full of blood, you're assuming there's blood in there. The assumption is that the blood got pushed out, right? That's the logic behind it. So you subtract the two and you get some kind of number. Make sense? So what this would look like is this. If you took your heart out on a shelf and had it squirting blood, you caught the blood for a minute, you would have represented cardiac output. You're going to beat so many times a minute, and then you're going to squirt so much blood each time, so the total work done is a beaker full of blood. Yeah.
Is this the same thing as ejection fraction?
More or less. Ejection fraction is related to it. Yeah. So ejection fraction correlates to cardiac output. It's just a way, it's like a percentage of ESV. So what do you think the number's going to be, Smarties? Not that you have to know the number, you don't. Got 10 seconds left.
5,000. 6,000.
6,000, 5,000, come on,
49.
go, bid up, yep.
49.
Looks like 6,000. For what?
Well, eBay moment
Well,
there.
it's at 5 and it's at 5 down there.
Right,
It's
eBay
at
back.
6, it's gonna be at 6.
Okay, so again, you never have to memorize this number, but this number you'll see people quote to you is 5 and some odd liters. So go to the store, buy 2.5, 2 liters of pop. That's how much blood your heart squirts in a minute.
So, knowing this, what do they use this for? Like, what do they use stroke?
We'll do that in just a second.
Okay.
There's actually a lot of things. But this also gives you a rationale of why if your surgeon nicks your aorta during surgery, you have about 2 minutes of your life. Because your heart just shot 5 liters of blood on the floor, and the doctor hit the aorta, right? Because it ejects that much per minute. Since you only have about 6 liters or so, you got a little over a minute of your life left, right? Yeah.
So if you have a low resting heart rate, does that mean that your heart is bigger or just stronger?
Stronger, in theory, or more moderate. So how does this relate? Let's go through it. This is where I care about, is the factors that affect it, not the actual math, but the things that make my output change. So here we have my my opium. My heart rate, beats per minute. My stroke volume, again, these are averages, about 70, and about 5250. Right? So I'm going to change your body in some way, and we're going to see what happens to the workload, the output of the heart. So let's start with an easy one. Let's do sympathetic response. So remind me from your last test what sympathetic was. Fight or flight. So what do you think will happen to your heart's work if you're in sympathetic mode?
It'll increase.
You sure?
Yeah.
Yes.
Positive?
Yeah.
Yes, good. So let's think about it. My heart beats faster, right? So pulse goes up. My heart beats harder, meaning it ejects more, what they call contractility. It's a fancy doctor word for more. So I'm beating more often, I'm beating more blood, therefore I'm getting more work done, right? Or my ejection fraction is climbing, right? So I'm getting more blood out of my heart per unit time. Therefore, I'm increasing output. That makes sense, right? If I'm running away from a tiger, I sure want more work in terms of my heart. All right? Make sense? So, parasympathetic innervation. What should happen to my cardiac output?
Slower.
Down, decrease, lower, normal, less, pick a word you prefer, right? Normal heart rate, normal stroke volume, normal workload. Make sense? Okay. I'm going to exercise you. What do you think will happen to cardiac output?
Increase.
Sure?
Yeah.
Good. In some ways, it's a sympathetic response. My heart has to beat faster, my heart has to beat harder, therefore I get more work, which makes sense because I'm running around, in theory, or thinking about running around. Make sense? So now, let's do this one. I'm going to speed your heart up, extremely rapid heart rate or tachycardic. So I'm going to give you some methamphetamine or something. So, what should happen to output if I speed up your heart?
Go.
I vote for down, I vote for up. I have confused looks. Got an arrow down. Let's try it. Ooh, wow, let's try that again. Ooh, wow, let's do that one more time.
Stays the same.
Stays the same. How did it do that, you may ask? Glad you asked. So what happened to my heart rate? My pulse went up, right? Why did that go down?
Because the ventricles can't fill up over.
Yay! Yes! Starling's law again. Let's review Starling's law. What did Starling say? Snap back. So, Starling said if I stretch a heart, what should happen to its force? It goes up, right? Okay, and remember last time we learned about that pausing system. Why did your heart have to pause? To give it time to fill. So if I'm speeding up my heart really, really fast, I have less time to fill and stretch it, right? Therefore, I'm going to get less blood per beat because I'm going to be violating Starling's law. I'm not going to have enough stretch to get the beat to eject blood. So even though I sped it up, I'm getting less bang per buck, so I end up with the same amount of work. Right? Because I'm violating the Starling's law, basically. So the analogy is you're going up the freeway at 55 miles an hour in first gear. Your car's revving like mad, but you're sure not getting very good distance to go up the freeway. Right? So what do you think your heart's going to do if you do this all the time? Get tired, more wear and tear. Again, just like first gear in your car, it's not best for the motor to keep running at a red line. Right? So let's do the reverse. I'm going to slow your heartbeat down because you're not stressed, you're not taking my class, you're taking alcohol, whatever. What should happen if I slow your heartbeat?
Stays the same.
Stroke volume goes up.
Very good. My work stays the same, but now I'm using Starling's law. If I slow my heart down, I have more time to fill, more time to stretch, therefore I get more blood per beat. Right? So I can beat less often and get the same blood. That's that Lance Armstrong trick, right? My heart rate's 35. Mr. Good, because he's claiming then he must be raising his stroke volume almost double mine to get the same amount of work. Liar. But okay. So if you have a high resting heart rate, that means your heart is less efficient because you're getting the same work with the same output with more beats. If you have a low resting heart rate, you're getting the same output with fewer beats because you're raising the volume accordingly. So if I lower one, I can raise the other, you hope, and keep the work the same. So in sympathetic response, I'm raising the beats and raising the force, so everything goes up. But in rapid heart rate, I'm just raising the beats, my volume actually goes down per beat. So this is overdrive on your car. This is first gear on your car. Same output for different rates of volume. Make sense? So you want to shoot for a lower resting heart rate, means your heart's getting more blood out. The same workout with less beats, more blood. So this. Make sense? Good old Starling's law? So you want to give your heart time to fill and stretch and eject. So let's do one more. Increased venous return. So if I do increase venous return, what should happen to my output? I have a vote for increased.
Uh-huh.
I bet you some of you don't even know what that means, right? Let's work this word down. More, what's venous mean, or venous?
Vein.
Vein. What's returning in my veins?
Blood.
Blood.
D, oxygen.
So if I have more blood coming back to my heart, what should happen to my output?
Whoa.
Whoa, let's look at that again. That's exciting. So my heart rate didn't change, but I'm actually getting more blood back to my heart. What does more blood back to my heart do to my heart stretch? What's it do? It
Makes it
stretches my
bigger.
heart more, right? Which makes Starling's law kick more out. If I kick more blood out per beat, I get more work done. Right, so I'm getting more ejection by increasing the flow of blood back to my heart. I'm stretching my heart out with more blood. And Starling says it'll snap back.
When would that happen?
When would that happen? I'm glad you asked that, because now we're going to show you how that happens. Yes. To understand that question, answer that question, we're going to take a detour to the blood vessels. Alright, so here's a blood vessel. This could be an artery, this could be a vein, a cap, some kind of tube somewhere. And you'll learn this in lab tonight, actually. But there's all these layers in your blood vessel. Here's the blood, in case you didn't catch that in the middle. And there's these little layers that make up the tube. Okay? Those layers differ depending on what type of blood vessel you have. So here are my blood vessels. The artery is on the left, the vein is on the right, the capillary is one up in the middle. You're going to look at the artery and the vein, just those two. So look at the red thing on the left, look at the blue thing on the right. Give me two differences you see between those. Hey, I heard valves. Who said valves? Raise your hands. Okay, what's the purpose of valves? Prevent backflow. So arteries don't have valves. Veins have valves. Okay, why would veins need to prevent backflow, not arteries? Keep looking. What's another difference you see? Thickness. Who's thicker? Okay, so here's my artery. I have a thicker middle layer than veins. So arteries are thicker without valves. Veins are thinner with valves. Explain to me why they look different. Why are those differences?
One's under pressure.
Which one's under pressure?
The red.
The artery. Remember, arteries carry blood away from the heart under pressure. Which one's thicker, a fire hose or a garden hose?
Fire hose.
Oh, a fire hose is. Otherwise, it's called an aneurysm and you're dead. So, this one has to be thicker to withstand the extra pressure. This one has less pressure, right? It can be less thick. So now let's ask about the valves. Why would a vein need valves then?
Gravity.
And there's low pressure.
There's no pressure. So if my pressure drops, there's nothing to keep the blood from going in reverse, right? If I don't have pressure, blood will just go anywhere. So the arteries have pressure forcing the blood away. But the veins, because they have less pressure, don't have the same force. So what keeps blood from going backwards? The valve. So we're going to walk through that logic here by looking at, in case you don't believe me, let's look at the blood pressure in the body. So it's hard to see. I'll dim the light so you can see it. This little graph is trying to show you the difference in the pressure. That's the force of the blood. So your heart's over here. Here's your aorta, right? Systemic artery. Here's some more arteries, little teeny tubes, veins, big vein. What's happening to my blood pressure? It goes down. As I move away from the pump, the pressure would drop, right? Being further away. As I add more tubing, the pressure drops. If you don't believe that, hook up 15 miles of garden hose to your house faucet and turn it on. Right? No water will get to the end because you're further away from the house, there's too much plumbing, there's resistance. So as I move away from my heart...
I have a question.
Yes.
So what happens if you put air into an IV? They
That's
say
bad.
like that's really bad,
Yes.
but there's valves there that protect from like.
They would just stop the backflow, but they wouldn't stop the air from getting lodged in their artery or a brain cell or something. So you get an embolism.
Embolism.
So it wouldn't stop the air from flowing with the blood.
Mhm.
So
And it would be like it would have to be like a lot though.
doesn't take much. Yeah,
Takes more
so-
than you might think.
Takes more than you might think, but it can be, it depends on where it lodges. You can have air bubbles that land someplace that you don't care about. If it's your brain or your heart, that's a bad day,
Yeah.
right? So, but you don't know, it depends on the size. The bigger the air bubble, the more likely it lodges.
Okay.
But here's my pressure. So as you notice, how much pressure do my veins have?
Like low.
Very little, almost zero. In fact, your vena cava doesn't have pressure. So if I want the blood to keep going through my body and get back to my heart, I have to compensate for the low pressure by keeping the blood from going in reverse, right? So take a look at this picture. So, your heart's up at the top, somewhere up there. This is your butt, here are your legs, right? This is some big vein in my abdomen. So I'm going to click this. Why isn't the blood going down? Valve. So since there's no pressure, gravity will want to pull the blood back down, right? If there's no pressure, you're going to pull at your feet. But it can't go down because the valve holds it there. So the only way the blood can go anywhere is up toward my heart, right? So let's do that. So every time you wiggle your legs or you wiggle a something, the muscles squeeze on the valve just like squeezing the toothpaste that none of us do. And you're going to force the blood to go towards your heart because it can't go backwards against the valve. It can only go up towards your heart. Right? For best results, squeeze bottom up kind of logic, that's this. Right? So let's play a little game here. What would happen if that valve broke eventually? Where would the blood go?
Back.
Okay. What do you call it when grandma has a big bunch of blood pooling in her legs and feet? Varicose veins is a product of you busting your valves. The valves go, the blood keeps going down, so your legs get bigger veins because you can't get the blood to move up. Right? What does grandpa wearing in the nursing home? Little magical compression socks. They're doing this. The socks are trying to do the squeeze on the veins to keep that blood going north to your heart.
So is it basically the theory, if you don't use it, you lose it?
More or less. Or what happens in varicosity, you've used it so much. A very common reason you use blow is if you're on your feet all day on something really hard with bad shoes, that blood keeps backing up into that valve, eventually can cave in. So if you want to cause varicosity, wear work boots and jump up and down on concrete for 8 hours a day. And you'll put, truck drivers are notorious for varicose veins,
Huh.
right? Because you're sitting in a truck, and the movement of the truck balances your legs, and your legs just keep beating the blood against those things.
Is that also, sorry,
Yeah.
is that also why they say don't cross your legs too?
I don't know if that's true. I don't know. But
So-
pregnancy will cause it because
Yeah.
the weight on the legs. Yeah.
So in the veins, there's just continuous valves?
Yes.
Now having, okay.
You can prove this at home. Here's a little trick. Try this at home sometime. If you take your finger and hold off a vein that you see, you'll see the blood pooling behind your finger, right? Because it can't get to the heart. If you take 2 fingers and spread them like that, keeping the blood behind the one, push it up, you'll figure out and you let go, the blood won't return.
Mm-hmm.
You'll end up with a deflated spot between. That's where the valves are. So you shut the one and shove the blood up, and the valve will close, and you end up with a spot with no blood in it. So you can find your own valves that way if you want.
Also, if you're like feeding the IV, you know
Uh-huh.
that you've hit a valve if you're not.
That's right.
If you turn
And
on
the bigger ones.
it, yeah.
So the concept we're going back to is since there's no pressure, you have to force the blood back to the heart, just like this. Right? And you say, well, Mr. Christie, I'm not moving my legs. Good. I hope you're breathing. Because that also puts pressure on your abdomen, push pressure in the veins, gets the blood to flow. Right? So anytime I'm pushing on veins, I'm going to increase the movement of the blood. Right? So let's go back to the original question I think Eric asked, which was how in the world do we increase venous return? Let's do that. If I want to increase the vein return, how can I do that? Exercise, walk around, moves my muscles. And as I use muscle, I'm squeezing my veins. Look at this, increased stretch. How about that? So as I'm moving around, the blood gets pushed back to my heart, so I get more return. So getting off your duff and walking around increases venous return, increases workload on the heart. Make sense? They also call this coach class syndrome. You're sitting on the plane in the cheapest seat I can afford, which is half a seat with a fat guy next to me, right? And I've been doing that for 8 hours, and what do you notice your feet have done in that 8-hour flight? Well, why do they swell? I'm not moving, right? I'm sitting there, I don't move my legs, there's nothing to pump the blood, so the blood and fluids begin to pool in my legs. Right? And then what happens if blood sits somewhere long enough? It can do what? It can clot. And then what do clots do when you get up to walk out of the airport? They break loose and go places like your head,
Oh my goodness.
and then you just died of a stroke, right? Deep vein thrombosis. But the concept is, the more often you move, the more circulation you get, the more venous return you get by movement.
So you're saying I should get off my butt and
Those words did not actually come out of my mouth, yes. Sedentary lifestyle is lousy for venous return. The more you move, the more output you get.
So fidgeting counts.
Fidgeting count, anything that moves a muscle. Sitting here and bouncing your leg, bad. That's why that's why cashier is a bad job. If all you do is stand there at the cash register. You're standing, the weight of the gravity pulls the blood down, but you're not moving your legs. So it can pull. So the idea is you have to be able to walk, move, stretch something, yes.
So doesn't falling or injuring yourself, that can give you a blood clot too,
Yes.
right? How does that work?
What happens then, like my dad did that, he fell
no.
on his hip replacement, that snapped off, made a blood clot, because he bled internally,
Yeah.
Oh, okay.
right? Once he got up and around, then the blood clot broke loose, and then it got in a vein or artery or whatever, and then it ended up getting plugged somewhere upstream, which caused the next set of strokes.
And the reason for the blood clot was because the body was trying to heal itself?
Right,
Okay.
he basically, long story short, he had 2 hip replacements because the first one went bad. He fell on the hip replacement, which made the metal break off. Metal popped a bunch of blood vessels. What do blood vessels do when they break? They start to clot, right? They bleed and clot internally. So he bruises, that makes clots. The clots didn't dissolve, they broke off when he fell and then went back up to his head. Right, so it's not unheard of, but that would happen also on a plane. You're not moving, the blood clot. But back to where we're going. Venous return, I'm moving around. More exercise makes more venous return. So if you want the best heart output possible, you would slow your heart rate and walk around, right? So I'd get more time to stretch, and I'd get more blood coming to my heart. So a nice calm walk in the evening moonlight kind of thing. Make sense? So that's affecting my heart rate. So now since we talked about veins and pressure, our last topic for your test is actually that concept of pressure. We're going to talk about it today and then a little bit after your test next month. Let's go through blood pressure. Which we want right here. Okay, you may know this from your training and the whatever, but let's pretend you don't. So we got the guy, we're going to put the cuff on him, we're going to do the blood. So here's an artery carrying blood away from his heart. I'm going to inflate the cuff. What should happen to blood flow?
Stop it.
It should stop, right? That's why you remove the cuff at some point, right? So, the blood stopped. The cuff is stronger than the heart, right? The pressure of the cuff is higher than the pressure in the artery, right? If I pop the valve and I reduce the pressure in the cuff, what should the pressure of the blood eventually do? What should happen?
Start going up.
It's to start going through the cuff, right? When the heart is stronger than the cuff, the blood would go through. But it'll only go through when the heart's actually pushing the high pressure, which would be the systolic motion, right?
Mm-hmm.
Right? The lower pressure of the heart wouldn't go through yet. As I lower the cuff pressure, more and more of the relaxed pressure should go through, right? So let's see that. Let's do that again. Cuff is stronger than heart. The contraction of the heart is stronger than the cuff. That's why you're hearing the thump, 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 thump. But now notice I'm not hearing anything, but there's still blood in the cuff. Why am I not hearing anything?
Diastolic.
Diastolic. My heart at rest is still higher than the cuff, right? So what you're doing to those sounds is you're hearing the effect of the heart and the blood and the artery on each other. So if you had a stethoscope on the person here, You're hearing nothing because you just killed them, right? When you hear the thumping, the heart can push the blood past the cuff and make a noise that you hear, sound of Korsakoff, as a thumping. That's a systolic. And then when you stop hearing the noise, that means the heart and the cuff must all be even all the time, which is the diastolic value. So you're hearing that turbulence of the push, which on a graph looks like this, right? Inflate, then deflate, and when you heard it was systolic, remember that word, contraction? Where you don't hear is that. Unfortunately, it's the only slide that doesn't have sound, so I'll do it for you. Right? So it'll be thump, 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 thump. You're laughing at me. Just because I'm an opiate addict, why are you laughing at me?
So, Jonathan,
Yes.
how can you explain the cuff and heart are even
Yes.
when it's? So I don't quite
Right.
understand.
So on this one, but right there, the heart's only stronger than the cuff when it's pushing the blood or systolic.
Okay.
Right? But right now, the heart is at rest, and it's still higher than the cuff. So that's what we mean by the heart. So the thumping is the heart pushing only when it's contracting. And here, even at rest, it's still stronger. So that's the diastolic. So squeeze and relax.
So they ask. So you're not supposed to have your patient cross their legs. Why would that affect someone's blood pressure?
I can't think of why it would off the top of my head.
Okay.
That could be just some
They
I don't know.
always-
I can't think of a reason why that would. Yeah.
Venous return.
Right. Mixture possibly. Yeah. But I can't think of a. There's no pressure reason per se.
Yeah.
So let's go through now. You know how to measure these things. Let's do things that affect them. So we're going to change your blood pressure.
Neat.
All right. The first factor we're going to look at is this one. It's called resistance, or peripheral resistance, which means in English how hard it is to get the blood somewhere. If it's harder to move the blood, what do you think the heart would have to do?
Work harder.
It'd have to work harder. It'd have to use more pressure. Right? Think of watering your plants. The further away the plant is, the more you want to raise the pressure of the hose. So the heart would have to overcome resistance to get the blood to move. Right? So let's do the first one. Here's a blood vessel. Oh, gee, there's a nerve to my blood vessel. Oh, goodness, that can change its size. So right now, my blood pressure is at 120, just some made-up number. I'm going to hit the nerve, and the nerve will make the blood vessel get smaller diameter, or constrict. What do you think the pressure would do if I make the pipe smaller around? It'll increase. I have the same amount of blood, I'm cramming the blood in a smaller tube. Right? Let's try that. Ooh, look at that. Up to 140.
So the top number would be bigger.
Yes.
Okay.
And probably the bottom number would be bigger too.
Okay.
So if I constrict your vessels, I would increase your pressure because I'm getting more blood in a smaller room. So let's write that down as a factor over there. So if we list the factors, so blah, 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 blah. So we're going to list factors that increase the blood pressure. So factor 1, vasoconstriction. In other words, making my pipes get smaller, constricting my arteries. Pick a word you prefer. So something that makes my vessels get smaller is going to raise my pressure, all things being even. Makes sense? So, let's do that again. So, make my vessel smaller, pressure goes up. So if you want to make your pressure go down, you have to make your blood vessels do what? Get larger or dilate. So if you remember what makes it go up, you just remember the reverse makes it go down. So a vasoconstrictor would raise it, a vasodilator would decrease it. Right? That's the same concept. So let's try another one. Here's some drugs I can give you. Not my opium. Here's some drugs. And we're going to see what they do. So let's try epinephrine. Oh, you know that from sympathetic. What did epinephrine do? Yeah, depending on where it is, right? Vasoconstricts my guts and vasodilates my outer organs. But it turns out if I add it directly to a blood vessel, it tends to make it get smaller. So it's called a vasoconstrictor. So my pressure goes up, which is what you think of when you think of the sympathetic, right? Fight or flight raises your blood pressure. This is partly why. I'm going to hit my blood vessels with epinephrine. They're going to constrict, raising my pressure, right? And there's some other drugs that do the same thing. But if I can make my blood vessels get small, then my pressure will climb accordingly. Make sense? That's our first one. Okay, this is the second concept we're going to look at, which is viscosity. Viscosity affects. What does viscosity mean in English? Thickness. So oil has viscosity, right? So the thickness of the blood. And this is due to how many RBCs are in the blood. Right? The RBCs add thick, it's like adding flour. The RBCs add thickening to the blood. So we're going to do that. I'm going to increase your viscosity by putting more cells in your blood. What should happen to your pressure of making your blood have more cells, which means less fluid?
Raises it.
Increase.
It does. Your blood's getting harder to pump because there's more solids, less liquid proportion. So again, add flour to your gravy. That's the concept you're doing here. Right? Adding more cells. So another factor thou shalt know, things that increase blood pressure is, number 2, an increase in RBC number. Because that is also known as your hematocrit. Okay? So if you're making more RBCs than normal, you could end up with your blood getting thicker, thicker, thicker. Okay? Okay? Now this also has a flip side which isn't on there. So we'll do number 3. I can also reduce plasma. Why would reducing plasma raise my pressure?
Because of the water.
That's right. If I take away the water, it's the same as adding the solids, right? If you cook your gravy or add flour, it's going to do the same kind of concept. So my plasma levels, if they're going down, that's leaving only the blood cells behind, and therefore it's getting thicker. We call this dehydration.
That's what he just said.
Yeah. So increasing? Yeah. It depends. So we'll talk about, there's another factor on this one, which is the electrolytes on top of it. It can. It depends on the specific. But for today, we're going to use these two as synonyms. So if I take away just plasma, leaving the cells behind, then I would see an increase in BP.
If you take away plasma, does that just promote more red blood cells?
It just leaves these behind. So you have less fluid, more solids.
It's just dehydrating.
So it's thicker.
Just dehydrating the blood, not the rest of you, right? So it's changing the density or viscosity. But this one is just showing you RBC kind of system, right? So if I decrease your RBCs, or add lots and lots of fluid, I guess, another way to say it, to the blood, then your plasma goes, your blood goes thinner. So blood thinner, quote, 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 is working on this kind of concept. Just the plasma and the fluid, we're not adding extra fluid or taking away. So if I take away, we'll talk about that next time, if I add extra fluid or remove extra fluid, then we can get other changes. So let's do our last one. The length of the blood vessel. So the concept is physics. If I add more and more hoses to my garden spigot, it takes more and more pressure to reach the end, right? If you have a 2-mile-long hose, it's going to take more than 20 pounds to get to the end. So as I add more vessels, it takes more force to get the blood there. So what would do that? Glad you asked. Here's some skin. What's under your skin? Lots of fat. Does fat have blood vessels? A whole heap of them, right? More than anything else. So if you gain more fat under your skin, what would happen to your pressure?
Increase.
It goes way, way up. Because now I have to send blood through all these tubes. And that takes more work than before. So if I increase body fat, dun, 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 this also works for other tissues, but fat's the most common one.
So what happens if they lose like a huge percentage of body fat? What happens
Then
to
your
those?
pressure should go down.
Well, what happens with the vessels?
They die.
Okay.
Yeah, it's kind of cool. You grow blood vessels to feed fat. As you lose fat, the vessels actually recede and die off. Or they'll be much reduced. So angioapoptosis. So if I gain body fat, my pressure goes up. Right? If I lose body fat, my pressure should go down, which is what your doctor probably tells you, right? All right, so let's piece this all together. On the right's normal, on the left is normal, on the right's my triple Whopper with cheese right there. All right? Take a look at the blood pressure of the two patients. What do you notice about the person on the right?
Higher.
A lot higher, right? Why would their pressure go up?
Gotta work harder to get past that.
Very good. My heart has to work harder to get past this because this is making my vessel smaller, right? Which is a factor. And then if you kind of read through the lines here, it makes my arteries less stretchy. So again, they're getting harder to expand, which takes more force to get through them. You could probably argue, I doubt you're really skinny doing this, right? So I put all those things together, your pressure will climb because it's harder to get the blood through the pipes. Right? So if your doctor doesn't check your blood pressure, it's a very easy way to tell what's inside the plumbing because the pressure will rise if there's those things. Will go down for some other reason, right? Let's do my dad, who traditionally until his stroke had very high blood pressure. Why did he have high blood pressure? Let's figure out. So, lots of reasons, but let's see what the doctor gave him. The doctor gave him pills to do what to his blood vessels?
To dilate.
Dilate. He's on a bunch of vasodilators, right? Can't really change hematocrit, but told him to stop smoking. That helped. Didn't help it soon enough. And they told him to lose
Wait.
about 50 pounds because if I lose the body fat and I make my blood vessels bigger, I'm reducing the triple Whopper with cheese, right? That's the effect. So that's the concept. If I want your blood pressure to go down, I remove these. If I want it to go up, I add these. Right? Those are factors affecting the heart's ability to pump through the pipes.
Does plaque in the arteries ever leave? Or
Yes,
it's like once there, it's stuck.
kind of both. You can have permanent plaquing scars, which will stay there forever. Most plaque for most people, quote unquote, tends to vary somewhat on diet and exercise levels. That's the whole cholesterol kind of voodoo. So some people can reduce plaque by changing their diet and exercising. Some can't. It just depends on the person. So there's a genetic component and a diet and exercise component. And then once you get scarring, then you get bacterial action on the scars, which then add more problems.
And the plaque just like floats off in the bloodstream and gets.
Yes, and you hope it goes to the liver, and the liver will process it, you hope. Yes?
So where does vitamin K2 come into the process of keeping your veins or your blood vessels?
Which vitamin?
Do you know what vitamin K2?
I do not.
Oh,
No K, normal K. Blood clotting one?
I don't know. I just heard about vitamin K2, how
I know
it keeps your
K1,
blood
I don't know if
vessels
there's a K2, so I can't help you with that one.
really soft or whatever.
They give it to people that take warfarin or Coumadin.
Well,
sometimes, vitamin
K is for
K.
blood clotting.
Yeah.
Mhm.
They give
I
it
don't
to
know about
babies.
specifically K2. I'm gonna say I don't know. I'm a druggie. What do I know?
Take alfalfa.
All right, so let's do one more little thing here. Oh, stop. I'm gonna turn off the sound. This looks like an exam kind of question. All right, so we have the patients at 140. That's higher than you should be, right? 120/80 is sort of the norm. And help this person, future nursing professionals, get their blood down to 120. Click the factors that will accomplish this. Will making your vessels bigger around help lower blood pressure?
Yes.
Yes.
Last time I checked. Wow, we moved like one. Making your vessels less stretchy.
No.
No, because that's a problem, right? If they don't stretch, they're going to get smaller around. Right? You want elasticity. If I give you more blood to pump,
No.
not really. That's that whole viscosity thing. If I add more blood, there's just more force. That's not going to help. If I make your heart push less blood,
Yeah.
you can do that. Sitting on your rear end, right? You have less stroke volume, right? So sit down, Mr. Christie. That would lower your blood pressure. Decrease blood viscosity.
Yes.
Yes. Make my blood, quote, thinner, easier to pump. Adding more vessels to pump through.
No.
No, that's the body fat trick, right? That's not going to help. Taking away a sympathetic drug.
Yes.
Yes. Because The sympathetic causes vasoconstriction, causes my heart rate to go up, causes me to fight or flight, all those bad kind of things. Ooh, we're at, not yet. Increasing another sympathetic drug.
No.
No. Increasing rest and digest land.
Yes.
Think good thoughts, Mr. Christie.
Cool.
Oh wow.
Oh, that's oh, wow.
You don't want to hear the all this, or you want to do it again?
Yeah.
Right. So that's the concept of blood pressure. And then next week, we'll do the actual renin-angiotensin cascade and start on immunity. But that's probably more than you want to learn tonight. So let's talk about your exam, which is Monday. Give them enough to live through.
I feel like I missed so much.
I missed this.
Wrong moment.
Wait, no,
That's
that's
like 112 exam. We're on enzymes. Label ATP.
something. Here it is.
Can I touch it?
Can you read it?
No. My hand. Look at my handwriting.
That should be in
No, I can read yours.
Okay, let's go through your test. So the first page has a couple ones on the endocrine regulation, not the chart of health. That's long gone, well, kind of. But you now have to understand the tropic releasing hierarchy, chain of command stuff, the bureaucracy. So if TSH goes up, what should T3 and like your presentation tonight? If T3 is low, what should TSH do? Where do you make a releasing, all that stuff. So you'll go through the chain of command of the tropics and the releasing hormones. Who does what to whom. But if it's not a tropic or releasing, you don't have to worry about the chart of doom anymore. So your final, then you got to worry about the chart of doom.
How many questions?
Right now there's 3 on that. All right. There is an EPO question that you better get right. Erythropoietin, EPO. Where do blood cells come from? There's a question on where old blood cells go to die and what happens to them then. That's the bilirubin. Can you walk me through how blood cells are destroyed? Okay, there's a blood typing question. If you are this, you can receive that. If I have this in the fridge, I can give it to him. Okay. What bloods can you give to whom and why? There's a question on what the different parts of blood do. So what's the job of an RBC? What's the job of a white blood cell? What's the job of plasma? And there are 2 questions on those damn clotting factors. Thou shalt know which ones are an intrinsic or an extrinsic, know them in order. If I asked you to fill in the pathway, could you put the right numbers in the right spot? Hint, hint, hint. Hint, hint. Okay. All right, then we have a big ugly question. You are a drop of blood. You're going to walk me right through every chamber, valve, vessel of your heart as you go from where I start you to where you get back. So you are a drop of blood. Name the chambers, the vessels, the circuits, and the valves on the heart, like we did on the board.
That's one page?
Is there any question about
One page?
ECG?
No, one question.
Oh, one question.
Well, we're getting there. Hold that thought.
Name chambers,
Well,
vessels.
Blood.
It's there.
Valves, circuits.
Yes. So you're a drop of blood. Name everything you pass through.
Can you say those again, chamber and vessels?
The chambers, the valves, the vessels, the circuits. Then also remember, are you oxygenated or deoxygenated? Right? All that kind of stuff. All right, so that's my question. All right, there's a big chart dealing with the cardiac cycle. So, for example, could you tell me what the heart's doing when the atria are filling? What chambers are doing what? What valves are opening and closing? Is the blood going in or out? It will walk me through the steps of how the heart beats and what happens in each step. And then on top of that, can you add the EKG on top of that? So in the P wave, what's doing what? What chamber is doing that? You will hate me with this question.
Yes.
EKG and cardiac cycle, put all that together.
So, in the EKG, V, QRS, that's how the question will be.
What is the question? Basically.
Come back Monday night around 5:30.
On EKG, do you want us to know what intervals, what's happening during QRS?
Well, not in any specific, just like I did before. P wave is SA node saying atrial contraction. QRS, you don't have to do these segments in lab you do, the segments and intervals, but for lecture, just P, QRS, and T. Just the letter groups and what happens in each one.
Do we need to know what is relaxed, what
Yep.
is, and how much pressure is in each chamber?
Not the pressure per
Okay.
se. Yeah, is it higher or lower? All right, so now that you're done and crying about that one, let's go some more. There's a cardiac output question. So what would make me have more output? What would make me have less? Jonathan decides to, whatever, do something. Would his pressure go up? I mean, his output go up or down? There is a question on the autorhythmic and contractile cells. Remember the depolarization, repolarization, sodium, calcium, potassium? Be able to walk me through how an autorhythmic cell works and a contractile cell works in terms of their action potentials. So, for
Can you say that
example,
one more time?
the action potentials of autorhythmic and contractile cells. So, for example, if Jonathan blocked a calcium channel in an autorhythmic cell, what would happen? Would the graph go up or down? That kind of thing. All right, there is a question on basically why veins have valves. I'll just say it. Why do veins need valves and not arteries? So that kind of comes up. And there's a question on the factors affecting blood pressure, like over there. So Jonathan decides to take a bunch of heroin. What would happen to his blood pressure? That kind of thing. Or my dad. Makes sense?
What about the altitude?
That kind of goes to the EPO stuff.
Okay.
So why do you go to Denver? What would happen to your EPO? And why? Make sense?
Do you have any sample tests we can look at?
Haven't seen that.
No.
Should if I need it.
I had it at home.
It's like I'm
Oh,
so
wait,
scattered,
wait.
my brain feels scattered, so I have to rewrite it.
They're probably online somewhere.
Organize
Someone
it,
probably
take it
posted
in,
them.
organize.
All right, so 7:30 we have a heart lab quiz. And we're done. Use your time wisely. Poorly.
Heart labs is just like